So this morning, Tyra McNeil, is it McNeil? Is going to talk about working at the Veterans Affairs Medical Center. And if you have questions, do you want questions while you're talking or at the end?
Pretty flexible.
Okay. And you okay with being recorded?
Okay, I guess.
All right, so we'll get started.
Okay. And you might have to refresh my memory on how to move through. Is it just the enter tab or the up and down arrow keys?
You can just tap the board.
Okay. Okay, sounds good. All right, like she said, my name is Tyra. I'm a social worker at Mountain Home VA Medical Center. I graduated with my master's degree from ETSU in 2012. So there is a light at the end of the tunnel. Just hang in there, and hopefully everybody's enjoying their studies. So this is just an overview. Actually, social work with veterans and military personnel have been in place since the beginning of this country with the Revolutionary War. Do we have any veterans in class today? Okay, thank you for your service. You know, that it's pretty much, with a lot of veterans being either active duty or in the reserves, there's a lot of opportunities to work with military families and service members out there, so more than likely you will come across this population. It's a great population to work with, and you also have a lot of diversity within the population, so just keep that in mind. And President Lincoln kind of made the speech that to care for him who shall have borne the battle, and for his widow and his orphan. And as a part of the Civil War, President Lincoln came up with that speech, and basically that was kind of the start of the VA and caring for veterans and service members who serve our country every day. So that was the motto for probably a little over 100 years now. I think they revamped the motto now, but we still kind of refer back to this. And then after the Civil War, the veterans' homes or domiciliary cares or kind of came into being. And when you think about domiciliary care, does anybody know what that might mean? Does anybody know what a domiciliary is? Where do most of you all live right now? The dorm, right? And so what a dom or a dorm is really just a collective place for people to live. And so after the Civil War, a lot of these were set up and called soldiers' homes, and it's a place where veterans could come, they could live, they could have the fellowship of their fellow veterans, get their medical needs met, and a lot of their other psychosocial needs met. So by the 1930s, Congress had established the VA as a federal bureau, and the VA started employing social workers around 1926. So it's been a while since I've had my history, but that's pretty early in the social work profession that the VA started to employ social workers. Does anybody have any questions so far? By the 1940s, the VAs started incorporating a lot of teaching and research into their programs. And why do you think that was a good fit or a good integration? Any ideas on that? Why might the VA partner with a lot of universities and and do a lot of research studies?
Because there was little known in the field back in the 40s about war, trauma, different types of battle wounds.
Right, to learn more, to find out what works and what doesn't work. What else? It's a good learning opportunity for the students, right? That's, whether you be a doctor or a social worker, you're going to get a good learning opportunity. You've got a population that has needs, and you've got professionals training, and it's a good opportunity to learn for the VA. So it's kind of what we call a fiduciary relationship. So it's a great thing, and I just wanted you to know that the VA is actually, and I just learned this too, it's actually one of the largest training programs for social workers nationwide. So there is a lot of opportunity for training at the VA. In 1988, the Department of Veterans Affairs was raised to a cabinet level department, so it is there with your Department of Education and all the other departments in your federal government. So we are a federal government program. So the kind of the roles that a social worker in the VA plays are kind of the roles like you would see in other community agencies, whether it be DSS, in the school system. We play the role of an advocate. What kind of opportunities do you think a social worker might have as an advocate for veterans? Can you all think of things that veterans may need that social workers may help them get? Housing, yes. Jobs, yeah. Employment's a big need. Counseling, absolutely. So we also have a lot of case managers, therapists, mediators, educators, and change agents. I think of a particular time period when a lot of social workers were able to assist veterans as a change agent. Can you all think of certain instances when a social worker might be instrumental in that role? I think particularly like in around the Vietnam War, and people's perceptions and responses to the military and to veterans probably may have not been as positive as they should be in. So that's an opportunity for social workers to be those change agents to kind of advocate for veterans and speak up for them and empower them as needed. Now, I did take some of this from the NASW website. Stressors related to the military experience may change over the lifespan as a service member moves through a military career to veteran status. For those veterans who were in a war zone, biopsychosocial and spiritual needs may change relative to life demands and exposure to critical reminders of war experiences. And so really, this is kind of sums up that the VA provides services across the lifespan, which I think is really important. You've all kind of talked about employment, housing, and those can be kind of crucial for younger veterans. But we also have a lot of service needs, as we're seeing a lot of veterans who from World War II, Korean War, and Vietnam veterans. They're at a different life stage, and they're looking for more long-term care needs and those other kind of life transition things that come up for individuals. I'm currently a social worker in primary care, and that's just what it means. I'm attached to a primary care team, so when a veteran comes in to see their primary care, if they have any social work needs, we're there, right there where they can talk to us. And so basically, we're kind of dealing with a lot of different things, whether it be employment and housing or long-term care, because we get a lot of both. So. A little bit, it's more of a generalist social work role and a lot of case management and referral. We also have hospital social workers, and
how many patients do you have under you that you sort of make sure that they have their wheels and all of that?
Okay, and so in primary care, we are attached to panels, and right now there's three primary care social workers, Michelle Fleming, I believe she spoke before, and Tina Rowland and myself, and I think we're attached to a panel, and we probably have somewhere between 5,000 or so veterans on that caseload. The VA serves a large number of veterans. Of course, not all the services are that intensive. They may just need an advanced directive, like a living will. They may have a long-term care question or a simple kind of referral that we could do. We do not provide ongoing case management. It's more just needs and services and referrals. Now, the hospital social workers do a lot of discharge planning. They cover people that may need, some home health things, oxygen, caregiver support, home health, that kind of thing. Caregiver support is a program that's really kind of instrumental in the VA because, like we said, a lot of these wounds from war cover the lifespan and may need some kind of long-term treatment. And it's not only does it affect the veteran, but it also affects the family. A caregiver support program is put in place to kind of address that as those natural supports might need care. The caregiver support program tries to address that. We also have a nursing home on station, and also we work with community nursing homes. We have a great hospice program. We also have VIST, which is visual impairment and services. A lot of times casualties of war may result in blindness, and so the VA has a good program to help with rehabilitation and special visual needs. And also TBI program. Does anybody know what TBI stands for?
Traumatic brain injury.
Okay, great. And so what do you all know about traumatic brain injuries?
Very rare to fully heal from.
Right. That a lot of times it's your functioning is impaired, right, and for a long period of time.
It could be like cognitive or behavioral issues, or even memory issues.
Absolutely. You can see a lot of different behaviors related to it. People may lack what we call impulse control. They may blurt things out. They may not know certain social cues that we have. And so, again, this is the area that the VA specializes in, and this is where a lot of this research comes into play, is that certain things like TBI or PTSD that are pretty relevant to the population, it's highly studied, and best practices are highly researched in the VA. And so that is a win-win for everybody because they get the best treatment that we have, and we can always learn new ways of dealing with things. So this is the social work service. I used to work in the under the mental health service. I've been a mental health social worker for a lot of years at various places in the community. And so I was previously a domiciliary social worker in the substance use disorder program. So the domiciliary here at Mountain Home is a place where veterans can come and stay. It's kind of like about a 3 to 6 month program now. We're used to people could come and stay for a lifetime when we're talking about old soldiers' homes. It's really kind of transition, but we still do offer the DOM. We have 3 programs in the DOM. We have the substance abuse program. We have what we call a psychosocial rehabilitation treatment program, which is a program for serious mental illness and PTSD. And then we also have the homeless program. So we have those 3 programs in the domiciliary. We also have social worker roles as an outpatient therapist. We have a program called NICM, which is for seriously mentally ill. It's intensive case management. We're talking bipolar, schizophrenia, your seriously mentally ill people that need assistance managing out in the community. We have the homeless program, which is HUD-VASH, where we provide housing and vouchers, employment assistance. And then we have an inpatient or E2 program, and that's for people who are crisis and need that inpatient hospitalization. Any questions about mental health? What do you all think some of the most prevalent mental health needs for veterans might be? PTSD. Right, substance abuse disorders is prevalent. Again, yeah, a social worker working in mental health will have to have knowledge of those kind of particular diagnoses and how to deal with them. And then how to get the little headline across there. But these are the 12 standards that NSAW have kind of set up for social work in the VA. There we go. And the first one is ethics and values. What kind of ethical and values things you think might come up when working with veteran service members and their families?
Come on, I got a bunch of you from my values and ethics class that took it and are in it now. What kind of values or ethical issues might come up for families?
I think advocacy for clients is certainly.
Okay, right. That you really need to be passionate about advocating for your client.
Yeah, have a passion for veterans and respect for the military.
Right, and just having that respectful attitude is important. There's also a lot of moral dilemmas that come up, a lot of spiritual questions, and so the ethics is a big part of that. And learning to deal with that and managing your own emotions and responses is really important. Like I said, the VA is one of the largest employers of master level social workers in the nation, and pretty much you're required to have a master's of social work to work at the VA. You're going to have knowledge of the whole lifespan. Like I said, you can think of you having a veteran who's 24 and coming out of the military is sure different than serving a veteran who's 64 and might be struggling with dementia and PTSD. So you're going to have knowledge of the whole lifespan. And psychosocial interventions for that whole lifespan. Assessments are really crucial and good in finding out where the veteran is, what their needs are, as well as the needs of the family. Intervention and treatment planning, practice and program evaluation. Again, I think this is something that the VA does really well. We do have good training programs. We have CBT, MBT. We have a lot of the cognitive, behavioral, and research-based therapies and that are implemented there, and we're all the time doing evaluations. Again, professional development, just kind of ongoing, working on yourself and as your skills as a social worker is important. Of course, the supervision, leadership, education, and training is important. Are you all doing any internships now? Or is this just an introduction class?
This class sort of has a wide range of freshman to senior.
Oh, okay.
So there's a couple people that are doing internships right now. Justin, I think, is one. Is there anybody else?
Okay.
Aaron?
I did one over the summer.
Okay.
Is anybody thinking about doing an internship with the VA? Okay. And what kind of questions do you have about doing an internship at the VA? Thoughts about it?
Just experience with it because that's what I found.
Absolutely. Yeah, and so you've had that experience as being a veteran, so you have that innate ability to connect with them.
I believe in order to do your field placement at the VA, you do have to be, it has to be in the master's program. So as a BSW level, you'll be doing your placement somewhere else, but keep that in mind when you move into advanced standing, hopefully, and, shooting for a placement at the VA. I know that they are very competitive, so.
What things do you do as an intern in the VA?
Oh, that's a great question. It depends. Like I said, we have the two different, we have the mental health and then we have the social work service programs. So we have two different sides of the house, if you will. So each side of the house is different. The social work service is more medical based. It's more, assessment and referral. And then the mental health is more of, working with a presenting problem, developing a treatment plan, and implementing those kind of things. So typically, we normally have more people, and I think this has just been my experience. Debbie may have more to add, but typically, I think we have more people or more internship possibilities on the medical side, learning how to refer to community agencies, connecting veterans to services they may need, basic resources, that kind of thing. So that's kind of what you do on the social work side. On the mental health side, we've had some people sit in, just kind of working under, a social worker. You're able to sit in on screenings, mental health kind of groups. I know I've had interns sit in on some of my groups. So also a homeless program usually has a social work intern. So that's always a good opportunity to get to see people in that arena. So there's a lot of different.
I had 2 students that worked with me at the pediatric clinic who then moved into their clinical year in their MSW program where they had their placements at the VA. And one worked at the domiciliary doing some case management and counseling and also running some groups, and she is now working there. And then another person was working with hospice and helping families with that transition, and she is now working there.
So there's good opportunities there at the VA for sure. And it's cultural competence is definitely a standard. With the VA, we get people from all different cultures, all different races, and all different backgrounds. It's definitely a melting pot, and I think that's true of the military culture in general. That that people transition from place to place, and it's a lot more fluid than it may be dealing with some other populations. And of course, advocacy, helping veterans get the benefits and the services they deserve and have worked for is a big part of the social worker role. Any other questions or discussions? You all have questions for me or thoughts about it? No? Right. Well, that's an introduction to social work at the VA. But it is a pretty big program. I don't know exactly how many social workers we employ. I would say it's somewhere 50, maybe more. So it is quite a large program. But like I said, we serve a large number of veterans. So.
Can you share a little bit about your greatest success and your greatest fail?
Oh gosh. Well, I don't know about my greatest success. I mean, the domicile. I had worked. Colleen that was in here before. I had worked. I started my career in the homeless program. Like I said, I'm a substance abuse counselor. Also, I have a certification as a certified substance abuse counselor. So I worked initially in the homeless program and started. It was called as I was really the first one hired as a HUD-VASH substance abuse disorder specialist. So when you think about really in the trenches kind of social work, there you go. You're doing home visits with people who may be actively using, who are high risk for relapse, and so that's probably some of my best work, starting groups to address substance abuse. you know, and kind of coming up with my own kind of program was probably one of the best, I would say one of my best successes. And then I went and worked for a couple years in a domiciliary. Again, continued to do group therapy, a lot of individual, you know, work as well. A lot of case management. I'm really good at housing placement, and so you know, and that's very rewarding, helping someone find something tangible such as housing, because that can really make a huge difference in somebody's life, right? I mean, that's a big kind of thing. And I think probably just the biggest weakness or failure, I would think, is just knowing the system of the VA. It's such a large and complex system that probably one of the biggest weaknesses is just not knowing everything and not knowing what resources are out there. It takes a long time to be really a good, effective social worker, I think, in this population, of knowing your resources and things of that nature. So that's probably been my biggest weakness.
That's like a question I have is like, do clients, like people who come in, like, are they, do they have to get into insurance, or is like the services free? I don't know.
Oh, that's a great question. Yeah, and so right, the VA is probably one of the largest healthcare providers, and so how do you determine who's eligible for benefits? Well, we have a whole department who determines if somebody's eligible for benefits. And basically, we work on priority codes. So veterans are assigned a priority code. So if you may have served, you know, you have to have an honorable or general discharge to get services through the VA. Every veteran's going to have what we call an ED-214, which is their discharge paperwork, and their discharge paperwork is kind of going to determine what kind of services they get. And they get assigned a priority code, and based on their priority code, different services are available to that veteran. Like I said, I'm in primary care now, and so a lot of times a big thing that's coming up lately that's totally new, a learning opportunity for me, is long-term care. And I don't know, I'm just on the news this morning, we were seeing all those little seniors in assisted living facilities, you know, and so that is a huge population and a growing population that needs social worker assistance and advocacy. And long-term care is super expensive. It's like $5,000 a month, and so not every veteran is eligible for long-term care. You have to be what we call service connection or service connected for that. So like at 70%, the VA will pay for long-term care. But that's kind of hard for the general population to understand, because when we think of the VA, we think of that domiciliary, that old soldiers' home. We think of people just coming there and living out their golden years at the VA, and really our care model's changed over time. And so that's that kind of, your benefits kind of vary. But most veterans, if they don't make too much money, are eligible for basic medical services. Other questions?
What does it take for the, I mean, how are some veterans eligible for long-term care and some not? What makes one any different from the other?
Okay, and you know, that's a great question. The VA is the Veterans Health Administration. We also have what we call the VBA, or Veterans Benefit Administration. And the VBA does just that. They assign benefits. And when I say benefits, we're talking about monetary compensation for a war or service-related injury, whether it be PTSD, you know, a foot injury, a back injury, a TBI injury. You know, so if you have a documented injury related to your military service, you can get monthly financial compensation for it. And so a lot of what social workers do is kind of assist veterans in getting their benefits that they might be eligible for.
So the worse off you are, the better you are to be taken care of.
It's still not enough. I promise you, it's nothing.
And what's your experience
I'm 90 service connected, so it's still nothing, so. And my social worker is actually like my everything because she does everything for me.
Okay,
Like,
okay.
she schedules all my appointments, all over here, over there.
So are you an OEF, OIF veteran?
Yeah, oh yeah.
And so different periods have different services put in place, and he's an OEF, OIF veteran, and they call it a triple O veteran. You know, is the current service period or wartime period we're under. You know, any veteran that served in a wartime period is going to be eligible for more services than somebody that served in time of peace. And unfortunately, you know, I do think that sometimes our system is geared to those, you know, to that. But I mean, just as part of the social work field, we all know we have limited resources, right? And so you know, sometimes you have to make those hard decisions about where do you spend your resources, how do you best serve this population. Like there's like 2.2 million active and just, you know, reservists currently in this country. So when you're talking about millions of people and how to provide services for millions of people, you know, you have to start looking at how do we triage this, how do we use our resources to best empower them to be able to deal with their wartime needs for the rest of their life. So unfortunately, those are not easy things, and that's where your policy comes into place. You know, like, and I never knew this policy, but you know, the long-term care comes from what we call the Millennium Bill, which was passed by Congress in the year 2000, and it kind of changed the long-term care for veterans, and so that set that rule of you had to have to be 70% more service-connected for the long-term care. My dad's 86, he's a veteran, you know, and he served in the Korean War, but he is still not eligible for long-term care, you know, and he's service-connected, but not at that 70% or more level. So it's just sometimes it's both rewarding and challenging working at the VA. So say that. But I enjoy it. It's a great population to work with. Yes.
How do you get your referrals? Do you, like, if a veteran comes in, are they automatically assigned a social worker, or like if they come in for care, can a nurse refer the social worker? Do you work closely with the RNs?
Yes, we do work closely with the RNs. Like if you are like an OEF or OIF, you would have a veteran on your caseload. They have more of a caseload, whereas somebody a social worker in primary care get more from a referral from an RN or from a doctor. So that's the biggest, and I think too, veterans telling other veterans about the VA is probably the best way that you know, they get, you know, acclimated and invested in our system. Any other questions?
Some great questions. Thank you.